Thanks so much for being here. I'm Rose McTivier, Chief Operations Officer and practicing therapist here at Midwest Counseling and Diagnostics. We are so pleased today to host the advocates, organizers, and legislators who made HB 1085 possible. We want to express enormous gratitude for Representative Lindsey LaPointe and State Senator Karina for championing this bill. To the People's Lobby for their relentless organizing. And to the wide coalition of legislators who voted yes, demonstrating strong bipartisan support for these needed changes. As a provider and administrator in clinical practice for the past 20 years, I have seen every day what underfunding and underpayment in behavioral health actually looks like. Long wait lists, impossible business models, slow and burdensome administrative processes that ultimately make it so much harder for clinicians to stay in network, harder for providers to stay afloat, and harder for individuals seeking care to actually use the benefits they are paying for. HB 1085 helps move us closer to a system where behavioral health is treated as essential health care, not just an optional add-on. So again, a very personal and massive thank you to the people who organized, testified, shared their stories, and refused to accept the barriers in place, instead seeing a path to create a real and positive change in service of the people that need it. With that, I am grateful to hand it over to Kate Redling.
Thank you, Rose, and thanks so much to Midwest Counseling for hosting us this morning. Thank you to State Rep Lindsey LaPointe and State Senator Karina for making this possible for us to have something to fight for. My name is Kate Lujan Redling. I use she, her pronouns. I am the board chair of the People's Lobby and the founder of our healthcare task force. I'm proud to stand here as a community organizer with providers and patients and legislators because we make up the community that made it possible for this bill to be passed. When implemented, HB 1085 will improve the reimbursement rate for providers so they can actually afford mental health care too, thus increasing capacity for all of us who need care. The People's Lobby is a grassroots, people-based organization that, aside from working in healthcare, organizes to win dignified work for gig drivers, for environmental justice in every corner of Illinois, and fighting for the progressive revenue that it's going to take to win all of the things that we deserve. So this partnership did not start when the bill was introduced. In fact, it started back when, for me, when we interviewed Lindsey LaPointe. She had taken a hard vote and was getting challenged. And we had an opportunity to meet and talk with her, and I was like, this is the one. We fought, we helped protect her and get her reelected. And because of that interview, I knew her background in mental health care. And when I wanted to start the healthcare task force, that was one of the first calls that I made. So when this bill came around and we had an opportunity to organize for winning HB 1085, there was no question. Now, what organizing means is that you don't do it alone, that you look around and see who is already in this work, Thresholds and Heather, Protect Our Care Coalition, all the mental health organizations working on this bill, and we collaborate together. Organizing this to win this bill means that building and maintaining a support system that the people who wanted to fight for it had something to opt into. It meant that we had a system for people to send their letters to their legislators, their state legislators, that we had a way to track it, that we could demonstrate again and again and again how deeply this bill was needed. And so when it came time that the industry would fight back, because that's what it does, we had the receipts. We took dozens and dozens and dozens of people to Springfield to the point where we had legislators say, y'all are everywhere. That's what it takes. We showed up at community meetings with our state legislators to demonstrate how important it was that we get this bill passed. So for partners like Thresholds, Access Living, NAMI, and other members of the Protect Our Care Coalition, we were able to fight together. This is a moment that feels truly urgent in all of the ways. And the only way to meet that moment is with full access to dignified health care and dignified mental health care. Nothing else happens without it. I can't keep going to my job without stable mental health care. I can't keep parenting. I can't take care of myself. This is the foundational work that we must stay organized on. So organizing to win this bill means that we stay in relationship. This was a fight based on relational organizing. We are going to keep fighting for all the things. This was not a one and done. We will maintain these relationships. We will keep showing up in Springfield. We will be rolling deep, and we'll be winning the bills that we choose to fight on next. Thank you so much, and I would like to turn it over to Kristen Holub.
Thanks, Kate. Hello, I'm Kristen Holub, and I'm here today because I know what it's like to need help and not be able to get it. In 2022, my eldest child had an acute mental health emergency. Even though my child was already in therapy and my family had good insurance, there was no care available to us. We had to take them to the ER and pay out of pocket to get them the medication and the care that they needed to stay alive. Even though our whole experience was awful, to say the least, I spent long periods of time on hold over and over, only to be told that the practice isn't taking any new clients or their wait list is estimated to be like a year out. It was crushing. Filling out long online intake forms, explaining our situation over and over again, just to be ghosted or receive an automated reply telling us that they couldn't help us. I was so stressed, scared, and worried that I had to put on a brave face for my family, and inside, I didn't know if I'd ever find my teen the care that they needed and deserved. I remember thinking as I'd hang up from another 45-minute phone call, why is this so impossible? No one should have to deal with this. Eventually, we settled for a doctor who was not a psychiatrist because we were out of options. Things were still pretty bad, and after a particularly rough Zoom call session, my husband and I decided that we had no choice but to go out of network and pay out of pocket to find a good psychiatrist for our child. We did everything right, and this was still incredibly difficult. I needed to be spending time with my child who was in crisis, not downstairs on the phone with the insurance corporations. That should never have happened. What do people do when they don't have the resources that I had? How do people cope when they don't have endless amounts of time to spend on the phone, money to pay out of pocket for great care, or a supportive network of family and friends? This is why I joined the People's Lobby. I realized that maybe I could do something small to help fix this broken system by uniting with other people who were motivated the same way I was. I found that I could participate in fixing the healthcare system even if I didn't understand the system inside and out. I started by reaching out to elected officials to set up meetings with the People's Lobby members just like me. Within the organized structure of the People's Lobby's team, we worked with Representative Lindsey LaPointe and others to ensure HB1085 won the support. And I even went down to Springfield with the People's Lobby, met with legislators in person, told my story, and asked them to pass this bill. I got a little emotional, as I am now, when I learned that HB 1085 finally passed, because Because what that means is that more mental health practitioners will be fairly compensated in Illinois, allowing more of them to stay in network and therefore be available for people like us that need them. There's more work to do, but nobody should have to go through what my family did. Thank you very much. And I'll pass it over to Senator Villa.
I'm going to veer away from my notes just for a second. So I was a school social worker for 15 years. This story that you just shared, I wish was so unique, but it's not. I had case folders after case folders that had similar stories. So when I became an elected official, no one gives you a folder that says this is how you do it, a binder that says do this. But every time I introduce bills, those same folders, they look very similar to the folders of my students. And every time I would close a case with my students, I would pray over it and then shred it. My bill folders are the same in my heart, because I don't just introduce any kind of legislation. So when HB 1085 came, it was one of my kids. One of my kids. And year after year, meeting after meeting, hour after hour, Heather, Sebastian, Lindsey, when we sat across those fancy lobbyists with real expensive, nice clothes on, it was intimidating at times with their big words and their lawyers speak. But those files were my kids' files. And you see, this bill was bigger than me and bigger than LaPointe. This was never our bill. This bill was your bill, the people's bill, the kids' bill. And so basically, we kept getting up to the finish line, and it was about to pass, and then it didn't, and then it happened again, and then it didn't. And so it was going to happen again. But because this bill was not about me, I walked into the Senate President's office because I realized something, that if that bill held my name on it because of some internal politics, the bill was again going to fail. So I took that folder, my kid. I walked into the Senate President's office and I said, Mr. President, please take this bill. If it has my name as chief sponsor, it will not pass, Mr. President. I beg you. And Don Harmon, President of the Senate, took that kid of mine and got it across the finish line, and that's how 1085 passed. We're not done. We are not done. We are just beginning, and I think that the insurance lobby better go buy some more fancy clothes. We're not done with them. So when people can't access behavioral health care because they can't find in-network providers, the crisis doesn't disappear. We all know that. They escalate and they turn into emergencies, and that shifts into our infrastructure, our hospitals, our emergency rooms, and what we need to make sure is that this isn't going to shift the cost in care into Medicaid and other public funded systems, right? Because what we know right now is that this Trump regime is slashing budgets for healthcare and mental health. It's impacting our state, and our state can't bear the burden, right? So we can't shift these costs on to Medicaid. So we have the Preventing Crisis Cost Shifting to Medicaid Act, and this act is about fairness and responsibility. It ensures that private insurance can't collect premiums and then offload the real costs of care onto taxpayers who are already strained in public systems. Sorry, I'm shaking. By holding insurers accountable, we can begin to stabilize our behavioral health workforce, bring providers back into insurance networks, and build a system that works for patients, providers, and communities across our state. This is about access, dignity, and making sure that when someone needs care, they can get it without delay and without financial hardship. So today we are calling on our colleagues once again in the General Assembly to stand with patients, providers, and families across the state of Illinois and support the Preventing Crisis Cost Shifting to Medicare Act. We are calling on insurance companies to stop prioritizing profits over people and to finally meet their responsibility to provide the care that Illinoisans are already paying for. We are calling on patients, parents, educators, and providers to stay engaged, just like you have been with 1085. Share your stories and keep organizing, because that's how we're going to make sure that we keep moving Illinois forward in this positive direction. Together, we can build a behavioral health system that treats mental health like physical health, supports the providers who do this life-saving work, and ensures that every person in Illinois can get the care that they need when they need it. Thank you so much, and I'm so happy to pass the microphone on to Allison Stager.
Can you hear me in the back? Okay. Good morning. I'm Allison Stager. I'm a member of the People's Lobby Healthcare Task Force core team and the emerging leader of the emerging mental health provider team. I'm also a licensed clinical social worker and owner of an insurance-based private practice who organized with the People's Lobby and Representative LaPointe to help pass House Bill 1085. While there are many difficulties in working with insurance companies, the one that therapists feel most acutely is financial. Despite advanced graduate degrees, 3,000 hours of postgraduate training, a formal licensing exam, and ongoing continuing education requirements, we are frequently compensated by insurance companies at 50 to 75% of our living wage rate. And despite skyrocketing costs of living and costs to operate a practice, insurance companies offer insulting raises of $1 to $2 every few years, if anything at all. Being a therapist then becomes a math problem, and therapists hate math. How many people do I need to see a week to keep the lights on and pay for my kids' braces versus how many can I actually see and give good care? I have had to create multiple side hustles for myself, someone with a master's degree, to generate more income and constantly fear an unexpected car repair or medical bill. Taking time off is weighed against losing the income I could be generating during that time, and I am forever running the numbers of client sessions, income, and expenses in my head. When therapy becomes commodified in this way, the quality of our work is impacted and the quality of our lives and our own mental health suffers. Let me be clear. Insurance companies are not gateways to care, they are the gatekeepers of care. In our healthcare system, people like me who are trained in mental health don't ultimately decide what treatment our patients receive. Insurance companies do. Most practice owners I know have to be selective about which insurance plans they take, which often means that many people cannot find a therapist who takes their insurance. Sometimes, we have to decide to subsidize what the insurance companies refuse to provide on our own by offering sliding scales or pro bono work beyond what we can actually afford. And when providing access to vital and life-saving mental health care becomes the burden of ours around this issue, I let them know that I was fed up with how insurance companies dictate mental health care and took on a role organizing therapists in support of this bill. We organize by 1, sharing information. Insurance companies profit off of keeping providers from accessing support and information. Policies, answers, and customer service are often shrouded in mystery, automated phone menus with no avenue to speak to a live person, and hours-long call times. I built power with my base by sharing information about the bill and making it easy for people to tell their legislators what they needed. 2, gathering stories. I held 4 provider roundtables in the fall of 2025 to hear directly from other therapists how insurance company rates and practices were impacting their ability to accept a range of insurance, see more complex clients, and have financial sustainability. Clear narratives emerged that painted a story of therapists struggling to make ends meet and clients unable to find care, and these themes and stories were used in meetings with elected officials to garner support, such as Don Harmon. Number 3, becoming loud and visible. Building real power with therapists for healthcare reform has required us to confront something uncomfortable. The way we've been trained to exist in the background. So many of us were socialized into self-sacrifice as a virtue, into scarcity as a given, into a weaponized version of compassion that tells us good helpers don't ask for more, don't take up space, and don't make noise. We're taught to absorb harm quietly, to manage around broken systems instead of changing them, and to mistake endurance for integrity. But that posture has never protected our clients, and it has certainly never protected us. To build power, we had to set that conditioning down. We had to get visible, we had to get loud, we had to risk being seen as too much in a system that depends on our silence. Collective change doesn't come from individual martyrdom. It comes from solidarity, from naming what isn't working, and from refusing to confuse compliance with care.
Yeah.
By passing this legislation, the patients and providers you see here have directly increased access to care in Illinois. If therapists are being paid more by insurance companies across the board, more therapists will be willing to take more insurances. If private insurances are paying at a higher rate, more therapists may be able to take Medicaid and Medicare. If it becomes more sustainable to make a steady living that reflects our advanced degrees and professional expertise, more people will enter or remain in the field. All of these things will enable more people to attend therapy while supporting the quality of life of the humans giving the care. Additionally, this rate increase has the potential to keep small business private practices open, prevent therapists from partnering with predatory venture capitalist mental health companies, and send the message that therapists deserve to be paid like the health professionals we are, so that we can do things like pay our mortgages, tackle our student loans, and afford to go to our own therapy. I wish that was a joke. This bill wins us a much needed raise for certain insurance plans, but for me and many of my colleagues, it demonstrates something more, our power. It's in our best interest and the best interest of the people we serve for therapists to stand up to the profit-seeking corporations that get in the way of us providing care. Victories like this allow us to think big and keep working toward a system where patients and providers can focus on care and healing rather than spending all of our energy fighting insurers to get the bare minimum scraps. Insurance corporations depend on us being quiet, disorganized, isolated, and fearful, but this victory proves that when we organize together, we send a message that is a demand for accountability, a demand for respect, and a demand for them to do their jobs. When we fight, we win.
Yeah.
Now I'm going to pass it on to Jason Anua.
Good morning.
Good morning.
My name is Dr. Jason Anua. I'm a general psychiatrist based here in Chicago, Illinois. 2 years ago, I started a practice with one of my colleagues from residency, Dr. Sarah LaPointe, called Woven Clinics. We started this practice with the idea that we wanted to focus on community-based psychiatry and increase access to care. When I was in medical school, I was also working on my master's in public health. I was doing community-based work, and I remember one of my mentors saying that the work that you do with your patients doesn't stop at the bedside. It doesn't stop in the clinic. It is adding your voice where the voice of our patients can't be heard. So when I was asked to join this press conference to speak about this bill, I was humbled. I've learned over the years that psychiatry is a humbling experience. It's both a practice in humility and humility in practice. I found in conversations working in the emergency department a repeating motif. We tried. We tried to find care. A mother, a father, a son, a grandparent, unable to access their medication. When we started our practice, I thought that after all the years of education and training, I might know a little bit of what I'm doing. But the insurance companies taught me that there was another degree to gain. That to learn to navigate that system was built in a way that wasn't meant to be navigated. That if I struggled to navigate that, then the patients that I serve would have the same problem, if not greater. So I just came to say thank you for the work that you all have done. This is the beginning, and I can't wait to continue to help move this legislation and everything forward. Up next, Representative.
Good morning, everyone.
Good morning.
Wow. This is what happens when you have social workers, more social workers, parents, psychiatrists, community members that urgently need behavioral health care all working together on a transformational bill. And with the words that have been shared this morning, I am just so grateful. And I already have deep feelings about this bill and what's to come. But the curtain was just pulled back on how meaningful it is. So thank you to everybody who has spoke already. As many of you know, I'm 19th District State Representative Lindsey LaPointe, and I am a social worker turned legislator, just like State Senator Karina. And we both prioritize affordable and accessible behavioral health support for everyone. For everyone. When we talk about behavioral health care, I want to unpack that a little bit, because sometimes it's a buzzword and not everyone understands it. We mean that comprehensively. Mental health support, addiction support, recovery, trauma support, and harm reduction. Those are the things that all of us will need throughout our lifespan. As state rep, I'm especially proud to officially represent thousands of licensed clinicians on the far northwest side, including Allison, who you've heard from. I'm also grateful to officially represent many parents who struggle to access behavioral health support for their kids and then who speak up, like Kristen, also a resident of the far northwest side. I have to say again for the record that HB 1085 would not have passed without many of the people in the room. That includes Senate President Don Harmon. Far and away, that includes Heather O'Donnell, who's standing in the back. It includes Matt O'Shea, who's not here. It includes Thresholds, and Amber, thank you for your work at Thresholds, too. We desperately need you. So we've heard about the organizing for this bill, which took 3 years of persistence, and that persistence signaled to the insurance lobby in Springfield that we were not going away. So it was what we call a hard bill, but I will tell you that many of the conversations with legislators were actually easy. And they were easy because legislators are humans too. They immediately understood it because they've lived it. I had one colleague who shared that she has paid out of pocket for her son's psychiatric care for years because the psychiatrist that worked for them didn't take her insurance. I had another colleague that shared through tears when she realized that she wouldn't have to take her son to a therapist and a psychiatrist on a different day, that she could do it on the same day because of this bill and save so much time. She was an automatic yes. And it was an aha moment where she realized this is going to impact her life. No doubt HB 1085 is one of the most meaningful, if not the most meaningful, mental health bill that we have passed in the last few years. And it's so meaningful because it cuts to the heart of the two biggest barriers to behavioral health care access. And one of those things is the endemically low reimbursement rates that keep providers out of insurance networks, or keep providers out of the profession altogether. That is a theme of mental health care. Whereas with physical health care, it is far better compensated and therefore far more available. So that is one of the biggest barriers. The second biggest barrier is the excessive red tape that you've heard about today. It creates an administrative burden that keeps providers from taking insurance, private insurance and Medicaid. And with Medicaid, it's really bad. The red tape is really bad. Many in this room know that. HB1085 breaks these barriers by holding private insurers accountable to cover what we already pay for with our monthly premiums by raising the reimbursement rates and cutting the red tape. And if you take a moment, as many of you do because it's your work, to look around at other meaningful mental health policies, you see those same themes. We had the Healthcare Protection Act in the spring of 24 and the spring of 25, and that got rid of prior authorization for inpatient mental health and for outpatient mental health. That is what cutting the red tape looks like, getting rid of that prior authorization. We passed the Community Emergency Services and Support Act first in 2021, and that law will treat mental health emergencies with a mental health response. That is on par with, what a novel thing, right? A mental health emergency. So let's treat it with a mental health response. That is on par with, but separate from, a physical healthcare 911 only response. And we haven't fully implemented that bill yet. We call it CESA. Some of you have been leading on that. And we are going to do it by the summer of 2027. Yes. So we passed those bills. We have to implement them at scale. And we have to implement them in a timely way. And that's what a lot of our work is about. But we also want to touch a little bit today, you heard a little bit from Senator Villa, on our next batch of urgently needed behavioral health bills. And why are they urgent? Well, we know, we've heard it, and we live it, but I'm going to put a fine point on it. The next bills are urgent because far too many people only think about 911 when they or someone they love is having a behavioral health crisis. And as we know, that can lead to deadly consequences. It's urgent because we still have way too many behavioral health clinicians that are choking in red tape. They're dealing with clawback issues. They're dealing with roster issues through Blue Cross Blue Shield, Cigna, and Aetna. So this is urgent. And when people do call 988, because some of us know about 988, and you do need somebody to come, like a mobile crisis responder, and then you need a place to go, we do not have nearly enough crisis stabilization units or living rooms, which are the places to go that is not jail and not a hospital. Because people don't recover in jails, of course. And to be honest, many people don't recover in hospitals either. So what is next this spring? And Senator Villa did a great job talking about the long name of one of our forthcoming bills. So I'm going to talk a little bit more about it. Because they have bill numbers now, because we are about to start the spring legislative session. So she mentioned HB 4785, which is called the Preventing Crisis Cost Shifting to Medicaid Act. What? I don't know. RB came up with that title. That's a tough one. So let's unpack it a little bit more. So this bill forces private insurance companies to cover crisis care via the state of Illinois, levying an annual surcharge on insurance companies, and that surcharge, the money, would go into our state's 988 trust fund. And the more money we put into the 988 trust fund, the more we are able to build out our three-pronged crisis system. And when that system is fully rolling at scale, we will have a place to call, 988. Fully staffed, well-compensated call takers, and it's not 911. We will have somebody to come like mobile crisis responders, not the police, and they'll be better compensated so they can stay in the jobs longer. And where we're really behind, once we pass this bill and build up the 988 trust fund, we will have far more places to go. The crisis stabilization units, the crisis recovery centers, and the living rooms, not jail and not a hospital. And we have a few of these today, a few, but not enough, and the public awareness is so low. It is just so low. Without this bill in particular, private insurance companies, and we know who they are, do not pay into the full continuum of crisis care. So this results in, as Senator Villa said, cost shifting to Medicaid and other publicly funded systems. So today, we rely on DHS grants, and we rely on some cannabis taxes, actually, to fund this transformational system where the commercial insurers who cover people that use the crisis system do not pay into this at all. So if we really believe that mental health care is health care, and we do, we have to force private insurers to pay for it. And that has to include crisis care. It has to include crisis care. The private insurers pay for ambulances, right? They pay for ER visits. So with this surcharge, we are asking them to chip in to 988, to mobile crisis, to crisis stabilization units, because mental health care is health care. Enough with only having jails and hospitals as a place to go. We are in a crisis, and it is time to hold private insurers accountable. I'm going to touch on another top priority bill coming for the spring, and yes, we have bill numbers. So this one next is HB 4585, and it comes from the Illinois Association of Behavioral Health Care. This bill slashes the red tape that our substance use treatment providers face every day. The bill gets rid of concurrent review for substance use treatment, including residential and detox, and the bill would finally get rid of prior authorization for outpatient substance use treatment. And this would apply to both Medicaid and state-regulated commercial insurance.
Nice.
So for those of you who don't speak insurance, what is concurrent review, right? Concurrent review is a painstaking process where far-away insurance companies review ongoing patient care, they revise treatment plans daily or weekly, and they create a boatload of paperwork and back and forth that clinicians or people that work in utilization management at hospitals, for example, have to spend so much time going back and forth with the insurance industry. That's what red tape looks like. It is high time we cut the red tape and focus on saving lives, and that's what this bill is about. And those aren't the only bills this spring. Many of you in this room have filed bills, and we're gearing up to work on them. We have more to do to relieve the administrative burden, and we have far more to do to connect people with continuing care when they come out of a crisis or when they come out of a hospital, because there is so much more we can do. I'd be remiss before we end here with these comments if I and we didn't mention the climate that we are all living in. And it is not a good climate for wellness. We have masked men in our streets that are abducting people. Here in Chicago, here in the Twin Cities, and in other places. We also have devastating healthcare policies coming from DC. Here in Illinois, we have 3.4 million people on Medicaid. 31,000 of those are in my district. 61,000 are in Senator Villa's district. HR 1 was signed by the president on July 4th, and it is a hatchet job to Medicaid. And many of you know that Medicaid is the biggest funder of mental health and addiction care in the country and in Illinois. HR 1 is also a body blow to state budgets all around the country. We in Illinois are slated to lose $51 billion of Medicaid money from the feds in the next 10 years. $51 billion. So if you didn't feel the urgency before, even though I know most of you do, I hope that you feel it now. We here do believe that mental health care is health care. So now is the time to double down even more and do everything we can in our state control to get people connected to care. And that's what so many of us in this room are going to do. We're going to continue to do that through this spring and beyond. We know because we've done it before, and we're going to continue to do it. So with that, that is what we have for you today. We know we have members of the media listening on live stream. I don't know if there's any way to take their questions, but we'll see if anyone from the media is here does have questions, we will take those. And if not, we are just going to hang out and eat some really cool cookies that say mental health care is healthcare on them. And talk about what we're going to do next spring.
Yeah, we want to get a picture of y'all, and so we're gonna grab this. We'll be careful with your husband.